Most of my patients are baby boomers. And baby boomers have to deal with some challenging issues. One of them is mom or dad's about to die. What do we do? And most of us don't want to think about that before it happens. So I'm suggesting that you do, and here's why. Here's the most common reaction if you haven't thought it through. We want anything and everything that can be done to be done for mom. Well, when you think about that, that starts to look like ICU. And this poor lady, anything and everything that could be done is being done. I don't want that for my family. I don't want that for my mom. I don't want that for my wife. I don't want that for me. I'd much rather have death at home. So again, this may sound like a morbid issue, but and the goal of this channel is to prevent death and disability. But when you start to get when death, so far most people that I know or have read about have died. So I think you need to plan for that. It'll be a much better outcome for you and your family members if you do that. Now, let's get a little bit more sinister and political here. Did you know that how your doctor is paid, or how your mom's doctor is paid, has an influence on whether she dies in the hospital or ICU or at home? That's true. There's a new study that's come out. It was in JAMA Internal Medicine recently, and it was covered in Forbes. And we'll talk about that study in just a few minutes. But first, a brief introduction. My name is Ford Brewer, F-O-R-D, Brewer, B-R-E-W-E-R. This is the Prevention Channel, and we're here basically to help you prevent death and disability. And obviously, the topic today makes it clear that you probably can't be successful in that forever. So you need to plan for all contingencies. And the reality is our goal is not to prevent death entirely. It's to prevent dying in your 60s or being disabled from your 60s to your 80s, but having a healthy life and extending that. Okay, so this is the Forbes article, Where Do Older Americans Die? And here is the JAMA article, Site of Death, Place of Care, and Healthcare Transitions Among U.S. Medicare Beneficiaries from 2000 to 2015. So what has happened is that Medicare has recently opened up the Medicare Advantage data, and people are starting to pour through the Medicare Advantage data and look and see what's going on. What's the impact with Medicare Advantage? Why the interest in Medicare Advantage? Well, a couple of things, both on a personal basis and a more global perspective. The personal basis is many patients or many viewers have started to call and notice that right now I'm not taking more cardiovascular patients. The reason for that is that was the vast majority of the PrevMed volume, and I'm focused now again on teaching primary care docs how to do what I do in prevention. I've been working increasingly in Medicare Advantage over the past year or so, and I know I will get a lot of haters both for slowing down the cardiovascular practice, but even more so for practicing in Medicare Advantage. Many people say, or the haters will criticize and say, this is for middle class and lower class folks. I want to be able to make my choices. You don't get, it's more of the old HMO style, et cetera, et cetera. I got it. I understand that. But here's the thing. I've never practiced in fee-for-service significantly in my whole life. To pay docs to get in and out as quickly as you can with a patient, and to pay docs to do procedures, to pay docs to admit patients, changes the physician's behavior. Medicare Advantage, to very many of us, maybe the first time Medicare's gotten it right, what they pay the doc to do is to slow down, take your time, assess the risks that the patient has, and educate the patient regarding those risks. They don't pay them to churn them through over and over again. How you doing today, Mrs. Jones? We're going to write you 3 or 4 scripts. See you later. See you in a few weeks. That's, I guess it's clear where my position is on that. And again, comment and beat up on me if you wish. But here's the data that came out of that study. I believe it was July 2nd, 2018. Site of death, U.S. Medicare beneficiaries, 2,000 to 215. So they got, here was the numbers. Medicare fee-for-service, 1,362,000 decedents. These are all people that have died. Medicare Advantage, 871,800. Average age, mean age was 82.8 years, 59% females. Mean age on the Medicare Advantage was 82 years, 54% females. Now, why do we cover that? Basically, that just lets you know that these are, number one, big numbers. Number two, there doesn't appear to be significant bias in terms of male, female, or other things like that. Okay. How many died in the hospital in Medicare fee-for-service when you pay the doc to admit the patient? Well, it started out at 33%, 32.6 in 2000. And by 2015, we had actually decreased it. So it's going in the right direction, down to 19.8%. How about Medicare Advantage? 10% lower. How about died at home? For 2000, it was 30.7%, and it increased to 40.1%. Again, we're going in the right direction, even when you pay the doc to admit the patient to the hospital. But again, with Medicare Advantage, you've got a significant lead. More people are dying at home rather than in the hospital. How about ICU? 24% in 2000, up to 29% in 2015. And this is having spent ICU time the last month before you die. ICU, again, 15% lower. So you're much less likely to go through that painful experience that you saw in that awful first picture that I showed. They also looked at multiple hospitalizations the last 90 days before death. Again, significant advantage to Medicare Advantage. So again, this is not so much a comment about politics, I don't think, as it is about how you pay docs. And the reality, as we've said over and over and over again, your health is not so much determined by getting more intervention by your doctor. So let's not pay him to intervene with you. Your health is determined by what you do, your lifestyle, how much you move, how you move, what you eat, how much you eat, how well you sleep. And that kind of thing, you need to make the decision yourself. So the best role the doctor can play is to educate you regarding your risks and how to manage them. Thank you for your interest.